Severe flooding in the Namaqualand region in the Northern Cape, Bongiwe, claiming several lives and significantly damaging key infrastructure. Main roads connecting communities have been closed, and in fact, the update tonight is the situation is so bad that the Nama Khoi municipality is in the process of possibly declaring a state of emergency. Dr. Gustav Bock is the mayor of the municipality, and we're going to join him. He's going to join us shortly. Dr. Imtiaaz Sooliman is the founder and chair of the Gift of the Givers, who is also expected to join us. So good evening to the both of you. Mayor Bock, I want to start by offering our sincere condolences tonight on the deaths of the members of the communities affected. And I guess one of the big questions, because we've been following it for a few days now, is the question of the role that the provincial government ought to be playing in this. Have they stepped in? Have they committed support? What have you heard?
Good evening. Am I audible?
Yeah, we've got you. Go ahead.
Good evening to you and your viewers. Yes, to get back to the question, when disaster strikes, there's an administrative component that needs to be addressed, meaning that, local authorities like the council need to sit and they need to assess damage and decide, do they have the contingencies to address all the damages and infrastructure backlog or damages? And then, if not, if it also is damage to infrastructure to the point where also lives are lost and people's houses are destroyed, they may consider to apply for a classification for disaster, and then subsequently, if approved by provincial and national government, a state of disaster is then declared. So the local authority works through the district municipality, and then they escalate to Costa and ultimately COCTA in the national sphere, and then National Disaster Management Unit in provincial kicks in. Now, you may appreciate that addressing a disaster is multidisciplinary, so local authorities need to do what they need to do, and also provincial government in the form of social development, health, transport safety and liaison. The South African Police Service with their search and rescue need to come on board, and they need to proactively address all the needs, the immediate needs within the communities. It's day 6 today, and we have yet to sort of given, social relief to the people in the form of parcels that has been sort of dripping in and dragging in since yesterday, day 5, post this state of emergency and floods. So
I imagine, Mayor, as you ask for those answers, and I appreciate, as you're saying, sorry to interject, we don't have much time on our side tonight, and I really want to cover some important issues for the benefit of the community there. There's a lot of help that you need in a situation that is fluid, pardon the pun, and moving, with people being compromised. We had the report on the SABC of a woman who was pregnant, giving birth to her child at home in Buffelsrivier. You need help, and you need it urgently. That help has been slower, as you've just said. What has been the reason given for that from the provincial authorities?
I couldn't get a clear answer. Numbers, they didn't have numbers from social development, healthcare, didn't have air support to get their medics in. And yes, air support also only came day 5, where we could really assess the damage within the towns. And like I said, you would have wanted that in day 2, day 1, and we only got air support at day 5 to really assess what is happening in Buffelsrivier, Kommegas and Kleinseer. Okay. Look, from my side, I am not here to point fingers at the moment. Slowly but surely, help is, coming into the towns and into the area. And for that, I am appreciative. For me, I would just like provincial government to be better prepared in future, and also national government.
Dr. Sooliman, your team is old hand at this. You've seen this happen a number of times. You have a fairly slick and sophisticated operational plan. We've seen it many times over. When you assess the situation here, what are some of those assessments and what can be done to assist the community, particularly with those services that the Mayor is saying simply haven't been there in the volume and with the same urgency that they ought to have been?
The poor Mayor is compromised, unfortunately. He's caught up in a situation. The mess up is from national and provincial government. He is just down the line. Municipalities don't have the kind of support and infrastructure that's required to deal with a disaster of this magnitude. And the poor man, he's dependent on everybody else. He can't do much himself. And government has failed over and over again in this type of disasters. This is not something new. I mean, the case that how much floods and disasters have we had over the last 20 or 30 years? I mean, we follow weather patterns. We give all the history of level 6 alerts, level orange alert, and you don't know you have to have helicopters on standby. You don't know you have to have your vehicles ready 4x4s. I mean, what kind of disaster management is this? They're never ready. It's 6 days. It's a disgrace. 6 days that people have been cut off. They can't get access to food, bottled water, mattresses, blankets, hygiene packs. The provincial government and national government is act instantly. This is not the role of municipalities. They can't do this. It's too big for them. And this has been happening over and over again. Fortunately, in the Western Cape floods, the Western Cape government made 2 helicopters available, people on the ground. We went into 54 areas in 13 days. Right. We can't get into one area now. There's no passable road right now.
Well, let's come back then, because I imagine that those communities who are watching tonight, who are wondering where's help going to come from, what kind of support can be offered at this stage? I know that they've been hoping for Give to the Givers to come into the community. What's the plan, Dr. Sooliman?
We are on standby in Springbok. Springbok is the operational center from which we have to try to move. Right now, as I'm talking to you, we're making calls to the Premier of the Northern Cape, Zamani Soul, to say, you need helicopters from you. We're going to be speaking to the Deputy President. We're even speaking to the Western Cape government to say, can you guys lend us a helicopter, because nothing seems to be moving in the Northern Cape. We may have to make a call to the Defence Force also. And fortunately, again, the municipality, the guys on the ground are trying to find alternative routes on roads. They've managed to locate some roads to which 4x4s can go through. We're talking about 5,000 households that have been affected in the entire region, right up to the Namibian border. There's a hell of a lot of stuff that's got to be moved by truck, by helicopter, whatever means possible. And we need government to act swiftly. We need those helicopters, and we need the public. Not only the government itself can't do this. We need the public to come forward. Whoever can bring helicopters, whoever can bring 4x4s, we need a lot of 4x4s. We'll supply the goods. Our trucks are already waiting in Springbok, and we'll send more stuff across. But this is going to require a concerted campaign from government, national and provincial, from municipalities, from the public, from those who got private helicopters, those who got 4x4s, and from corporate companies to support in terms of the material resources, in terms of food, new clothing, blankets, mattresses, bottled water, hygiene packs, and of course at some point maybe some medical supplies will be required also.
All right, so that's the inventory list I was going to go to next in terms of what's needed. But Mayor, if we can talk about those who sadly have perished in this catastrophe. We know that some bodies have been recovered. Some are still missing tonight. What can you tell us about some of the stories that you've heard and how that happened and developments in the search and rescue and the recovery efforts?
Well, I would just like to thank Search and Rescue. They've been on the ground since day one, and they have been intensively going through the areas in search of the missing people. They have to date found four people, and one is still missing. 3 people are unidentified. There's a lot of illegal miners also in the area, and one individual is that of a local community member, like I said, the other one is still missing. So obviously there is loss of life, and when there's loss of life, the urgency levels need to be very, very high. So my condolences also go out to all the family members that grieving tonight, and we hope that we can assist in future with regards to all the necessities needed for them. Yeah.
Just a quick status on the road and the safety for people to get in and out. We know that 5 communities had been cut off. Some of those roads, some of the major arterial roads have been compromised. Just a quick update on that one.
So basically, the N7, which is a SANRAL responsibility, 10 kilometers before Fiolsdorp and Rooiwal, That is seeing the most damage. There was a small detour that was created that is only for light vehicles. No trucks can move past that road. With regards to the access road to Buffelsrivier Kleinsteed Kommegas, that is the R355. That road is totally destroyed. There's almost a 50-meter break with all the underwater pipings, showing where the river just, swept it away.
Yeah.
That is not accessible for any vehicle. There is a low water bridge access that can only be accessed by 4x4s, and we encourage the public with light vehicles not to use that. It is in a private road, and this road system is also the responsibility of public works, so they need to find an alternative route for goods and service to be accessed and brought to the people there in Buffelsrivier, Kleinsteed and Kommegas.
Quite a few government entities were named during the course of our interview, so hopefully we will be able to just check in with them as well over the next few days to find out, how they will respond and perhaps respond more urgently. Dr. Imtiaaz, just to close, it is a race against time in many ways for communities who might be cut off from clean water supply, and even if they boil, one doesn't know. We've seen cholera outbreaks in other parts of the countries. We know that it can be quite serious, access to food, medical supplies, and so on. For people who want to assist, maybe just a way for them to connect with the community and with your organization, but also maybe again to make the point of just how up against the clock we are.
Well, let's take it from the example of even from what happened in Citrusdal. When we got there, 4 days later across the bridge that was low-lying, there was joy, jubilation, ululation. People were just overjoyed to see supplies coming in. And remember, Northern Cape are far poorer communities than parts of Western Cape. And there's hunger, there's starvation, there's loss of jobs, there's difficulty long before the floods came. And, so those people are going to need extra support in terms of empathy, warmth, dignity, kindness, compassion. And we need to do it fast because these are South Africans. And we need South Africans to support fellow South Africans as fast as possible. We will need, of course, material support. But as the mayor said, those 4x4s, those roads we can get through. We're too late. We're 6 days. It's just too late to take things so long to get items into the area. But without the helicopters and without the road, we're stuck.
All right, so something needs to give, and of course, as a station, we will try to get answers from as many of those who are involved in this and should be involved in this as possible. Thank you very much for talking to us tonight. Again, the thoughts of the country are with those communities that are grieving and who are suffering tonight. Gift of the Givers founder, Dr. Imtiaaz Sooliman, and the Nama Khoi local municipality mayor, Dr. Gustav Bock.